today and earlier today, we've been hearing a lot about competitiveness and the need to keep Europe competitive. And that's something that I want to elaborate on now. And we've also been hearing about the Draghi report, and a key part of that is about ensuring that pharmaceutical companies want to bring their products to patients in the EU, and not just a few countries in the EU, but all of the EU. And I know that's something that is very close to your heart, Minister Damianos, and I know that that's something that also you spoke about at EBSCO today. So I'd like to hear a little bit more about what was discussed there on that, and what changes you would like to see in the space. Thank you.
Thank you. So, I mean, we strongly believe that the EU can serve as a global beacon through its commitment to care, innovation, creativity, and democracy. The pharmaceutical sector is crucial both for the health of the citizens of the EU and with respect to its economy. You will see findings in the Draghi report on competitiveness and in pharmaceuticals. And I mean, we have seen the EU working together during the COVID-19 pandemic with respect to the vaccines. So it has been a very good way to cooperate when there is a crisis in order to avoid the worst. And we think that it went well. And we shouldn't just wait to deal with these things when there is a crisis. We should work together to, let's say, work against the challenges of the lack of pharmaceuticals, because we believe that for a union like the EU, we need to have every single medicine available to every single person within the EU. So I mean, medicine should be available, accessible, and affordable to everyone. So it's not just a matter of being available, it's also a matter of being affordable in order to buy, because different countries have different economies, different powers, and so that everyone's on the same page. If you're a smaller country, there's no economies of scale. It's difficult to attract pharmaceutical companies to actually come and sell, and it's much more difficult to do it if we're talking about medicine that is not widely needed, but might be too important to actually have. And that's something that it is an issue that we have been facing in Cyprus over the years. We do provide everything for our people. This does not necessarily mean that we provide everything on time, because something might not be available within the country. That might not be available within the country because pharmaceutical companies will obviously launch the product to a bigger economy. That's fine, it makes sense. But smaller countries need to have that product too. It will delay sometimes. We manage to get these products, even on a name basis, not as quickly, not as fast as we hoped that we would, plus the cost of that is, we believe, quite high comparing to other economies. So irrespective of the pharmaceutical package that will improve, let's say, availability, it is something that we have always thought that we should try, especially after the COVID-19 pandemic, especially after the vaccines, give it another shot to try and buy together. Joint procurement. We appreciate the difficulties around the issue, so we came up with a proposal, voluntary. Maybe might not be for everyone, and not for everything. Let's say we have innovative products that are not available in some small countries, and it's not just Cyprus. We have visited Malta a couple of months ago, even bigger countries that are lacking this type of innovative products. We believe they should be available, so let's try from 2025, let's say, on 𝐻𝑡a product, on 𝐻𝑡a medicine, to try and, on a voluntary basis, to try and buy together, make them available for everyone, for every single country that wants them, and obviously try and push the price down so that we're able to keep this medicine to all our people. We can start with oncological products. They are needed. We need to have them. It's not for everyone, but those that actually are in need of this medicine, and we believe that we should try. As I said, we're trying to start something on a voluntary basis. It has been seen positively today. We had 7 countries signing with us.
We had
And
some
another-
nods from your fellow health ministers earlier, so when you were talking about it.
Sorry?
We had some nods from your fellow health ministers when you were talking about the issues.
So, I mean, there's quite a few countries now that do support that, and we strongly believe that we should try. We are going to need the assistance of the Commission to actually do it together. We're talking mainly about small countries that might not have the resources or the knowledge to actually undertake this together. We need someone to actually help us do this, but we feel that it's for a good cause. We're doing it on a solidarity basis. It actually proves solidarity among union members, and because we have talked about competitiveness, we have a fragmented market, and it is within the Draghi report. And I mean, USA, China are more unified. So I mean, we can boost competitiveness even through joint procurement. So it can be a good start for many things.
Thank you, Minister. I'm sure many people will want to pull you aside afterwards and chat to you about that proposal.